All right, Mr. Chair, if you're ready, I can start the recording.
Thank you, Rob. Good morning, everyone. We'll call this Grey County Long-Term Care Committee of Management meeting for September 12th to order. Just like to welcome everyone here today. We have just to remind individuals of their obligation to declare an interest. Seeing nothing, if anything should arise, you may declare it at that time. First report up to date is the LTCRCM 1623 report regarding the long-term care director update. Be received for information. Can I have a mover, please, to get that on the floor? Member Patterson and Member Hutchinson. Thank you, Jen. We'll turn it over to you.
Great, thank you, and good morning, everyone. I'm just going to bring my notes in front of me. So someone speak up if you have a question partway through, because I can't see you all anymore. Thank you, Mr. Chair. So this report is for information, and it's a summary of updates since we last met. In July, and I won't go every single date, I promise. In July, the Ministry of Health did release a memo regarding the fall booster campaign for vaccinations for COVID and encouraging people to consider delaying their COVID-19 until the fall. We will have a further update at the operational report. Den is going to give a little bit more information on where we're at currently, so I'll leave that for that discussion. Family updates. We held a virtual family meeting on July 5th, where we also shared information about our designated care partner program. So this program continues to evolve as it's a fairly new program designed during the pandemic. And it's important to get feedback from people in terms of their experience along the way. And overwhelmingly, a very positive experience felt by individuals participating in the DCP program. And so we're really pleased about that, and we'll keep you updated as the program evolves. Infection prevention and control strategies. The IPAC and wellness leads for each home continue to assess current practices and prepare for fall outbreak preparedness. And here we are in fall. And as I mentioned, Den is going to give an update of kind of where we're at status in terms of outbreaks and respiratory illnesses. As part of that work, the IPAC leads did participate in a virtual respiratory exercise that was hosted by Ontario Health West and public health units. And they looked at a number of areas to ensure that long-term care homes, hospitals, community organizations were prepared for the fall. The three leads will also be attending a Grey Bruce public health workshop coming up. Again, an opportunity for education, updates, networking, and tabletop exercises. Just a short finance update as we are deep into budget preparation season, and in the long-term care land, we hold up to five budget lab days where the executive directors and our partners in finance come together and allow us to work really focused on preparing the budget in a collaborative way. Staffing and training. Our homes continue to recruit for RNs, RPNs, PSWs, and food service workers. We continue to work with new student placement opportunities with colleges in our area. In collaboration with the human resources team, we have held some lean training and lean solution-focused days in July and August. We brought together team members that support our back of office procedures, including onboarding, scheduling, and payroll. And it was a couple of really, really great days. And we look forward to implementing our strategies in our day-to-day operations. We also recently registered in the Preceptor Resource and Education Program in long-term care. We call it PrEP LTC. And this provides long-term care homes funding to increase the quality and capacity of our clinical student placements and for the following placements. So PSWs, RPNs, BSCNs, nurse practitioners, and internationally educated nurses. The PrEP LTC goals are to address the barriers to increasing capacity for clinical placements, providing a positive, high-quality experience. So short form, we really want students to have their placements in our homes. We want them to have a really great experience, and we want them to think, long-term care is a career for me. I can see myself in long-term care for many years. And so the goals of the PrEP LTC program really align with our vision, and it's even better because we receive funding to be able to support this program. So the funding covers a student placement coordinator, and we have done our recruitment, and it's a temporary position, and that individual will provide support to students across all 3 homes and coordinating with the leadership teams in the homes. And the funding also provides backfill coverage. So the team member that the student is partnered with isn't trying to do their own job and be a preceptor. So we have funding to cover backfill, and this should really help improve the student experience. It's not a great experience if you come in and your partner your preceptor that you've been partnered with is trying to do their job and perhaps they're working shorthanded. It just doesn't make for a great experience. So we're really looking forward to implementing this and seeing where the program goes. We've also been working with the Center for Learning, Research and Innovation in Long-Term Care, CLRI, as part to support their PSW education program and to offer 2 educational sessions in the fall here in Grey County. Living the Dementia Journey is one, and One Day is the other. And these 2-day sessions will be held in person, and there's funds provided by the province to allow us to have PSWs attend in person, and then we are able to backfill those positions when they're out of the home for the day. So one, it's really exciting to be able to offer in-person education here in Grey County, as opposed to trying to coordinate and send people to London or Toronto or somewhere outside of here. And 2, it's very exciting because the 1-day course features a series of videos that include residents and staff from Grey Gables. So it's pretty exciting. And the theme of those videos is kind of what's person-centered care? What does person-centered care mean to a PSW, and what does person-centered care mean to a resident? And hearing it from the residents is really powerful. And there are residents who live at Grey Gables. Recovery and wellness continues to be a focus, a lens that we look through in all of the work that we do. And the 3rd quarter of the wellness newsletter will be released at the end of September. And it will include information about our employee assistance program, wellness tips, color it stories, and also highlight some information from the staff appreciation picnic that was held yesterday. And it was an excellent event. Kudos to the human resources team and everyone else who worked to make it a really excellent event. Really pleased that there were a number of team members from long-term care that were able to attend and be recognized for their years of service, ranging from 5 years to 35 years to 45 years. So really great accomplishments, and congratulations to all of our team members who have reached those milestone years. I'm going to leave accreditation. Renata's going to give an update on accreditation in the operational report. And then a little note about the Fixing Long-Term Care Act update. The Ministry of Long-Term Care has hired 10 investigators. These investigators are undergoing a 19-week training program. I just want to highlight that the investigators are different from inspectors. So my understanding is these investigators will go to organizations that have really been struggling to meet their legislative requirements, and not going to where the inspectors are going to follow up on critical incidents and do their proactive inspections. This is the next level. And the 11 areas that they will be investigating against that could result in licensees being charged are listed here in the report. So duty to report, reporting false information, failure to report to the director, attempts to suppress reports, whistleblowing protection, and so on. And so you can see those are really significant and really important areas that need to be complied with. And so that's a new initiative with the Ministry of Long-Term Care. And finally, partnerships. In July, our homes were introduced to a proposed trial. So this is a research project out of Alberta, University of Alberta, called Connecting Today to Combat Social Isolation and Loneliness. And this is a virtual visiting program developed by Dr. Hannah O'Rourke from the University of Alberta. And the program aims to increase social connection and reduce loneliness for individuals with moderate to severe dementia and long-term care. As part of the grant application, the program required letters of support for long-term care from long-term care across Alberta, Ontario, and Saskatchewan. This trial really aligns with our Color It Connect program that was introduced at the beginning of the pandemic, and we were happy to provide a letter of support and look forward to participating once the program has been approved. And we'll provide updates when we hear something. The Ontario Caregiver Organization and Ontario Health have a new initiative called the Essential Care Partner Support Hub. And this aims to ensure that family caregivers are included as part of the care team in Ontario hospitals and long-term care homes. And Grey County Long-Term Care was invited to participate in the promotional video. So on August 8th, a film crew visited Rockwood Terrace, where team members, designated care partners, and myself shared our experiences and participated in the filming. So stay tuned for that movie debut coming soon. On September 14th, Grey County Long-Term Care, so that's this week, we'll be presenting at the Advantage Ontario's annual long-term care funding and reporting webinar series. The focus of our presentation is sharing our experience and resources for budget preparation. And I am pleased to mostly be doing the introductions, and Karen Kraus and Marcus Hawko will be delivering the bulk of the details in that presentation. In October, we are participating in the Advantage Ontario's leadership training program, sharing our experience in an emergency management module. This will be an in-person session. We have presented this module previously as part of their virtual leadership program. And the Ottawa Canadian Association of Retired Persons, so the Ottawa CARP branch, has invited us to present our Color It Change journey. And this is virtual as well. And it will include an overview of our Color It journey and the continued work that our teams are doing to ensure person-centered care. As always, we continue to be very grateful for the support from the committee and council, the CAO and senior management team, and all of our partners in partner departments. And that is the update.
Well, thanks, Jen, very much for that in-depth report. And as always, there's great things going on in long-term care, and I look forward when the Oscar nominations come out for your new film.
Thank you.
Please.
I see Warden Milne has his hand up. Chair
Yes,
Mackey.
go ahead.
Thank you, Mr. Chair. Jennifer, if we could just go back to the Fixing Long-Term Care Act update for a moment. Can you elaborate a little bit more, if you could, on what is the difference between an investigator and an inspector? If somebody's coming to investigate, does that imply that there's been a complaint or something of that nature? And why wouldn't the inspectors follow up on a complaint or something of that nature?
Yeah, thank you.
Please.
Thank you, Warden Milne. And through you, Mr. Chair, that is our understanding, is that complaints, critical incidents, proactive annual inspections will continue to be managed by inspectors, and investigators will be deployed, I understand, in more serious situations of perhaps ongoing non-compliance, organizations that have had director's orders with compliance dates that have passed with no reported action. That's my understanding, is that it would be in very special circumstances.
Okay, I'm not. Okay, good. Thank you.
Yeah, I will look to see if I can find some further information and circulate it to committee with perhaps a better definition. It is quite new, and my gut says that if an investigator is coming to our home, we would know. We would know that it was coming because we've been struggling and not meeting compliance and not implementing action plans and not following up on inspectors' reports. Or there's been something very serious happened.
Okay, thank you.
So Jen, just to follow up on Warden Millen comment, these charges could be levied against any staff person up to and including an executive director. Is that correct?
But I believe so. Any of the EDs, do you happen to have that policy open? No. Why don't I make a commitment, Chair Mackey, to gather a little bit more information and circulate it to committee with more of those details.
All right, thank you, Jennifer. Any other questions from members in regards to Jen's report? Member Patterson, go ahead, please.
Thank you, Mr. Chair. Just a comment, Jen, I want to say I had the opportunity to watch the virtual family meeting. You do a wonderful job, and there's lots of good information in that, and I'm sure the families really appreciate it. So well done.
Thanks, Sue. Any other questions? All right, all in favor of receiving Jennifer's report? And that is carried. Thank you. Our next report is the LTC Long-Term Care Operational Report from June 23, please.
Through you, Mr. Chair, I apologize. We think you had a quick cutout. I believe the chair called for a mover and a seconder, but I haven't yet seen any hands.
Sorry, yes. Did I cut out? I did ask for a mover and a seconder, moved by Warden Millen and seconded by Member Keaveney. We will turn this over to Jen to start with. Jen, go ahead, please.
Great, thank you, Chair Mackey. Oh, we're just going to get names all mixed up today. That's good. Every time a hand goes up and down, the boxes all switch. So thank you. Through you, Mr. Chair. I'm just introducing this report because we've made a little bit of a change. So historically, we have had our operational report in open session, just as we have here today. And then twice a year, we've had a closed report that spoke to a number of items of personal nature that might identify residents and or team members. We continuously review that process with our partners in the clerk's office to make sure that we're meeting all of the requirements for a closed session. And so we have opted to, in the spirit of transparency, move the critical incident summary into the open session operational report. And so you'll see that in the report. And when we get to that section, Karen is going to speak to that. I'll just highlight that it's aggregated data, because if we did it individually, it would become fairly easy to identify if you happen to work or live in one of the homes. So we've bundled the data. I think for most cases, we can speak generally about what a critical incident is, what we do about it, what our action has been in open session. If there's desire to speak more specifically about specific incidents, and we would need to discuss perhaps personal information, then we would need to talk about going into closed session for those discussions. And then I'll just highlight that you'll notice there isn't a closed report in this meeting. We are planning to have an HR update at the November meeting, and Director Moreau and I are working on that. And that should cover off some of the data that was discussed in our closed reports historically. And so again, we're looking at ways to be able to have this discussion in open session in the spirit of transparency and and the public good. So I will pass this over now to Renata, who is going to start with the quality section.
So Jen, just one question before we go to Renata. If there was a critical incident that you thought was noteworthy that the committee members should know more about, would that be added to the closed session agenda?
Yes, we would do that.
All right, thank you. All right, we'll turn it over to Renata.
Good morning, everyone. For our quality data, CIHI has not released any new updates, and so the information you see there we spoke to at the last meeting. For accreditation, we have completed our self-assessment using the Accreditation Canada Long-Term Care Program Manual. The manual is broken into 6 chapters, and for example, governance and leadership focuses on the organization's operating standards, medication management on medication practices and safe and reliable services. Resident experience focuses on meeting the residents' needs by providing quality care. These results are currently being reviewed and action plans developed to address areas for improvement and compliance to the standards. We will begin auditing this compliance using a tracer methodology. This method and this is the same method that the accreditors will be using when they come in to survey. This method follows the path of a resident or an administrative process and ensures that the standards in our policies are being met. Over the next several months, residents, families, volunteers, stakeholders will be involved in preparing for accreditation. And that's where we are to date with our preparation for accreditation next May. Are there any questions?
Any questions from committee members? Not seeing any. We'll go on to Karen. Welcome, Karen. You're going to talk on critical information summary.
Thank you, Mr. Chair. Good morning, committee members. Yeah, so as Jen mentioned, we have changed the report a bit to include this information that was previously covered in a closed session report. And as you may be aware, we are required to report a number of circumstances. And in fact, everything that's listed in the report, we're required to report these circumstances if they occur in the home, or if we even think they might have occurred in the home, to the Ministry of Long-Term Care via a critical incident report. There are also timelines in conjunction with these circumstances. So some issues require immediate reporting, and that even means after hours. We call an after hours pager number, and some are next business day. So they all are broken into categories as to severity and when they need to be reported. They're also all reviewed by the Ministry of Long-Term Care, initially electronically, and sometimes they send back questions electronically. Sometimes we get a phone call to review critical incidents, and sometimes, as you know, they come to the home to review a critical incident. So the chart in the report identifies the number of critical incidents reported for all 3 homes combined during the reporting period. You'll see we have 11 under abuse and neglect. And just a reminder that anything alleged has to be reported. So before we even investigate, if a resident or family member uses words like, my dad feels the PSWs were rough with him, or the nurse spoke harshly, those things, that's when the red flag goes up and we are required to report. The investigation happens after the fact, and then we report our results of the investigation back to the ministry. And abuse and neglect can be resident to resident, or staff to resident, or visitors' families to resident. So it's not just restricted to a staff issue. And all team members receive annual training on abuse and neglect as required by the Act. We did have 2 transfers to hospital due to injury. These incidents are usually the result of a fall, and it must result in a significant change of status to the resident. So it could be a fall where they have broken a hip. So now their mobility will be affected at least temporarily. And there was one incidence of controlled substance missing or unaccounted for. This could be something that's noticed when the nursing staff are doing narcotic counts and there is a pill or some liquid missing. Or it could be a patch that has been applied to a resident, and when they go to remove it, they can't find it. Sometimes they get caught in the bed sheets, or the resident takes them off if they're able to reach it. So that could be another circumstance that we would use a CI to report this issue. And be happy to answer any questions anybody might have.
Thank you, Karen. Any questions from committee members? Karen, I have one question just in regards to the timelines for reporting and investigating. What are they, please?
So some, as I said, some issues like abuse and neglect, for example, require immediate reporting. So if it happened right now, they would expect us to report it right now. Or if it happened at midnight tonight, the expectation is it's reported at that time. We then have 10 days to follow up, complete our investigation, and update the critical incident report. Other items like a missing resident, depending on how long they're missing, could be next business day. So we could have, if it happened today, till tomorrow to have that reported, and still the same 10-day guideline to follow up.
Thank you. All right, if there's no other questions of Karen, we'll move on to Dana. Morning.
Good morning. And through you, Mr. Chair, as you can see in the report, there was one outbreak of rhinovirus experienced by our care communities during the reporting period. It affected 3 residents and all recovered. However, as Jen alluded to, we certainly have an evolving situation. And so I'm providing an update of what we're seeing in our community related to outbreaks and what we plan to do as we move towards a respiratory season that will continue to be atypical. So I checked this morning, and presently in Grey Bruce, Public Health is reporting 14 active respiratory outbreaks in retirement, hospital, and long-term care homes in our area. And as of that this morning as well, we've gone up to 10 COVID outbreaks, along with 2 rhinovirus outbreaks, 1 para-influenza, and 1 outbreak has an agent pending. Lee Manor happens to be one of the homes experiencing para-influenza in one of our home areas. And although we're still in outbreak, we have no active resident cases. We are awaiting Public Health to declare the outbreak over. But keeping this data in mind, the IPAC and wellness leads, along with the teams at each of the care communities, are preparing as best we can to protect our residents and staff and ensure our plans are in place to address the respiratory season ahead of us, with, of course, safety and resident quality of life in mind. So I just wanted to give you a brief overview of what we have in place. So right now we have vaccine clinic plans ready to go for resident, staff, volunteers, and designated care partners. And as soon as Public Health announces the vaccines are in, we are planning on getting our orders in place, get the vaccine in-house in our fridges, and then plan to act quickly to vaccinate. So our teams are ready to go. I also attended, along with the IPAC and wellness leads, and Jen alluded to that, the provincial pandemic preparedness tabletop with Ontario Health West. And we completed a virtual exercise with community partners from our area, including our paramedic services, primary care, hospital, and public health partners. We went through our respective plans and discussed any potential gaps and how we would address them. We have our PPE stockpiled, and we're looking for storage spaces to continue to ensure we have enough supply, and we continue to monitor that on a regular basis. And then we're also having all staff up to date on their mask fit testing. And our medical directors are ready to finalize the medical directors to ensure we not only have the vaccine orders ready to go, but also be ready with any antiviral treatment if necessary. And unique to Grey County is that we're able to do remdesivir right on site for our residents if needed as one of the COVID antivirals. We're constantly auditing and reviewing our IPAC practices and tools in the home, along with supporting our frontline staff and the best prevention approaches, along with early detection and testing, as well as looking at our staffing contingency plans. And on Friday, the IPAC and wellness leads communicated to all team members, giving them an update of the current situation so they're aware of what we're experiencing. We're reviewing the symptom screening questionnaires and what to do in the event they have symptoms, strongly encouraging them to stay home. As well, we are providing rapid antigen test kits for staff for their in-home use. And we've been communicating these plans to our residents and families, as Mayor Patterson alluded to, the town halls and communicating and letting residents and families be aware of what the plans are and getting their input. And finally, tomorrow, the IPAC and wellness leads will be attending the planning session, again, that was mentioned in the director's report. And there we'll see and hear about the vaccine and fall respiratory season update from public health's point of view. And we also anticipate the Ministry of Long-Term Care will be sharing upcoming information. So to share with you, we're definitely in ready mode.
Thanks very much, Dana. It's nice to hear that we're well prepared. Is there any questions for Dana from members of the committee? Not seeing any. We'll move on to Shannon, who will talk about all the good news stories. Go ahead.
Yes, thank you through you, Mr. Chair, and good morning, everyone. On page 12, you'll see the people chart report. As you can see, we're continuing to recruit and onboard staff. Our numbers are definitely improving by comparing the number of staff onboarded versus the number that have resigned. That being said, human health resources continue to be a priority among the care communities, and we are continuing to recruit for all departments. Under the events section, the residents in our care communities continue to enjoy lots of programs in the homes. Some of the highlights have been participating in the fall fairs, antique car shows, strawberry and ice cream socials, summer barbecues, music programs, cooking and painting programs, and trips to Dairy Queen, with a few carnival days put in there as well. It's always so nice to see the joy that the programs bring to our residents. I also want to mention that Lee Manor hit a milestone for celebrating their 50th anniversary in June. That day was celebrated by featuring speeches, live music, refreshments, and historical displays. Congratulations to the team at Lee Manor for such a wonderful celebration. Thank you.
Thank you very much, Shannon. And Shannon, you weren't done yet.
Oh,
were you?
Yes, I'm finished. Yes, thank you.
Okay, thanks. We'll now move on to Stacy.
Good morning, everyone. Thank you, and through you, Chair Mackey, I will share some updates on our resident family councils, and I get the privilege of highlighting a colored story. So resident and family councils continue to be a vehicle to bring about positive changes for residents in our care communities through their feedback. And based on input from residents, residents councils focused on education opportunities during the reporting period. And at Grey Gables and Lee Manor, there was coincidentally a shared interest in learning more about the IPAC program. So the IPAC and wellness leads were invited to attend the meeting in their respective homes. And in each case, the residents really appreciated the opportunity to be face-to-face, ask questions directly, and they really enjoyed that interaction. And at Rockwood Terrace, Residents Council also had an education component to their meeting, and they learned about potential phone and internet scams targeted at seniors and how they can protect themselves. And as already mentioned in the other reports too, the highlight of our family councils was an opportunity that combined family council members and other interested participants from each home to join a virtual event that featured Deborah Batke, our author of Now What? Managing the Emotional Journey of Long-Term Care. And many members have since read Deborah's book, and it offers a very unique perspective of both a family member and a professional healthcare provider navigating long-term care. So the response to this event was overwhelmingly positive, and Family Council hopes to build upon the momentum of the presentation and create opportunities to connect Family Council members with families and friends of residents moving into long-term care for additional support. We were delighted to host this event, and we really look forward to the new ideas and that this opportunity inspired. And in terms of our Color It story, there are so many ways that residents experience Color It moments in each of our homes on a daily basis. And it's my privilege to highlight one of these special moments that stood out for us here at Lee Manor recently. Sometimes despite our best efforts to reintroduce and engage residents to reignite maybe a past passion or a hobby, they have their own reasons for declining this invitation. And we always respect that decision. And eventually down the road, we reapproach with some encouragement and try to identify what might be holding them back. And it's particularly special when we're gifted with a random change of heart and are witness to the courage that it takes to initiate that first step. And that's exactly what happened for one of our residents who had disengaged with most things that previously brought him joy. But suddenly one dusted his accordion from the closet, and no one asked any questions. They very quickly sprang into action, got him up out of bed into his chair, placed the accordion on him, and the sounds of the music brought a huge crowd of people to his room. The care team knew exactly what room it was coming from. They knew exactly what was going on and were just completely overwhelmed with joy. And knowing how much this would mean to his family, a team member recorded the moment as he was playing. And with the permission of the resident, of course, the video was later shared with his family, who were overcome with tears of joy. And we're so grateful to have captured that moment that they'll forever cherish. And it was just a beautiful Color It moment. And I don't think there was a dry eye in the crowd. And we are certainly hopeful to hear the sounds of the accordion again. But even if we don't, we're going to cherish this opportunity to have colored it for the resident in the moment and the joy that it brought everyone. And it was just a refreshing moment of, passion for, why we do what we do every day. So it was a lovely, lovely story that I'm privileged to share.
Compliments and Color It stories. All our seniors. Any questions of Stacy's portion from committee members? Not seeing any. All in favor of receiving this report? And that is carried. Thank you. Our next report is resident home areas and common rooms for Rockwood Terrace. Can I have a mover to get that on the floor? Moved by member Nielsen and seconded by member Hutchinson. And Jen, I think this is being turned over to you again. Go ahead,
Great.
Please.
Thank you. Thank you so much, Chair Mackey. And I'm just going to share my screen to share some slides because it's really more than just a list of names. And I want to share the intention and work that has gone into what it takes to make somewhere a place that people want to be. Now, I didn't really need to do slides because I think Stacy's story just highlights what makes something a place, a home, a community. Having said that, I'm going to share them anyway. So I think what I did was screen one, share. I'll just confirm, Chair Mackey, that you're seeing. Yes, I see nods. So
yes, we are.
Good.
Thank you.
Okay, great. So as I mentioned, a lot of information, a lot of work, and a lot of discussion and intention goes into the design of a long-term care home, and all with the vision of what is it going to be in terms of a place. And so we've done this work, thankfully, under the leadership and support of Kasian and Forge Media and Design. And the bulk of the images that you'll see and the quotes and the words on these slides are shared from presentations that Forge Media and Kasian shared back with us in their presentations in their proposal of design. And so the whole focus of this discussion is, in terms of redevelopment, we had this goal of creating a sense of place through design, color schemes, materials, patterns, finishes, and signage, all with the kind of North Star of honoring the past and coloring the future. And so Forge Media, this started months and months and months ago. Maybe I can't remember. Time starts to lose. I start to lose track of time. But at least a year ago, Forge Media supported us in user group meetings, UGMs, that were virtual. So we were still, heavy into the pandemic, and the virtual meetings really allowed us to include a broad number of people. So the virtual meetings, the user group meetings included residents, frontline team members, leadership, and my family members and myself. And they just came with a whole list of questions in terms of, tell us about Rockwood Terrace, tell us about your vision. What makes Rockwood Terrace a place that you like to live? What would it make? What would change to make it a place to find joy, and so on and so forth. And following those meetings, they helped the leadership team at Rockwood to hold sessions or exercises in person with residents, team members, and family members. And they call those charrettes, and because I'll mention that a little bit later. And so they sent all of the tools to Rockwood, and Rockwood pulled these teams together. And this is just an image that shows one of the groups working on this work to use images to help describe their vision for Rockwood Terrace. And so they took all of that information and they presented us 3 themes that they would that they wanted us to consider in terms of design, fabrics, materials, color schemes, naming. And so the first theme is biography, the reflective mirror. My story has a beginning, but never an ending. As the place I call home, the persons I call friends, and caregivers work hard every day to keep my memories alive, as well as helping me make new ones. Every day is an experience. I'm often pleasantly surprised, encouraged to participate, to feel a part of a team of doers and cheerleaders. I know the space reflects who I am and what I stand for because my story is represented within. And the focus is to be honored, represented, and recognized, to feel included and engaged, and to say that my story is recognized. And this was based on some of these quotes that came from the user group meetings. And this lived experience was a recurring theme that was expressed through the transcripts and the exercise sessions. And so this was a big focal point in what determined that biography was a theme. Theme 2 is community, the tree of life. And community was another word that was reflected a lot in the discussions. And again, it's that our community and its residents are rooted in an intertwining of earth, bricks, mortar, culture, natural rhythms, genuine familiarity, and pride of place. We take pride in that we are different because we are not defined by somewhere else. We are the comfortable in between. My community is big enough to live in, but small enough to care, as here is there and there is within reach. The community is within me, and I live within my community, and it's to be connected, to feel a part of a family, and to say I am my community. And this really came from there was a lot of discussion about what makes Durham and Rockwood and rural Ontario different than other places, and this was what the design team got from those discussions. And then here's some quotes. Community is the word we use a lot. It's the lens that we apply to the work that we do. And then just some other quotes that came from the groups. And the third theme is dwelling, the hearth. And this really came from the discussions about what is homey, what is home-like, and what does that actually mean to be home-like. So in this place, I feel in place, a part of it, not detached or outside of it. I feel grounded. The things that are my story are with me in this place. The colors I see are warm, and the textures and patterns feel solid and reassuring as they tell me when I've entered a new space without thinking too hard about it. This is the wayfinding. I can easily find my way around. Large words and familiar icons help me recognize and recall where I am. The information I see to help me find my way feels conversational, feels respectful. It's not clinical, condescending, or patronizing. I see the picture and things most precious to me and my favorite color that I've chosen, and I know I've arrived where I live. And the goal of this hominess, this dwelling, is to be connected, to be in place, and to say, this is my home and I belong. And then here's some quotes that just led to that theme. And so then the Kasian team that presented the design and the color schemes and themes took that information and bundled it into what I'm going to share now. So the project goals of design is to honor the past and color the future, to create a calm, stress-free experience, to use the potential of environment to create an experience, to improve wayfinding and access to information through the use of color and graphics, to create an inviting and caring environment, to communicate care and appreciation through design, and to portray a sense of community and belonging through the design. And what came through loud and clear from the group discussions and the charrettes was this concept of nature, community, sense of place, and history. And so that's what the team used to propose this concept. And these images are, some of them are taken from, the team actually came up, the Kasian design team came up and drove around Durham and spent some time in nature and in the surrounding area. And so it led them to the themes of the design, which is the 4 seasons. And some of the other elements and inspiration was in terms of water. So streams in spring, waterfalls in summer, cascading waterfalls in autumn, and frozen waterfalls in winter. And if we had all sorts of time, they had slides that showed actually the textures of, like, when they show a picture of a frozen waterfall, what are the textures, and then that's what helped them decide the fabric, the texture of the fabric for the furniture, and so on. So it's really amazing and very interesting, the level of intent and detail that goes into this. And so then they bundled this into what does this mean in terms of wayfinding? So the principles of a wayfinding strategy is to develop a vision for a dignified way of life, to design the environment to reflect human scale. And I did a little research to better understand what that means. And it means that, and this is the layperson's translation from an architect, it means that if we have signage in our homes that direct people to where they go, we can resonate with it. It's not too big, it's not too small. It fits with, if we're sitting in a wheelchair or we're standing, we can see it and read it, and it feels right. Optimize stimulation, afford people the opportunities to choose to be alone or to be with various size groups of people. It promotes movement, engagement, and meaningfulness, and it affords people the opportunities to enjoy contact with nature. And so that leads us to the exercise of naming the home areas and the common rooms. So the team, Kasian and Forge Media, got us this far and said, okay, now Rockwood team, you need to send us a list of some names. And this is much harder than one would expect. It's not an easy task, and we take it very seriously. And so we continue to use the concept of nature, community, and place to come up with these names. And so I'm going to flip to the screenshot that shows the concept of the new home. And so this is the level 1, this is the main floor. And as I mentioned, the design color scheme is based on the 4 seasons. And so when you walk in, you come into this big common area that is, it's going to be representative of all 4 seasons. And when you come in, somewhere in here is the bistro. And we're proposing that the bistro be called the 369 Bistro. And for any of you that live in the Durham area, 369 is commonly the first 3 digits of the phone number of people who still have a landline in the Durham area. And then beyond that is a gathering place, like an auditorium, a large gathering space, and we're proposing that that be called Gara Fraxa Place. And on this home area to the left of the design, you can tell I'm not a planner because I'm not using north, south, east, or west, and I'm going to stick with that. This section is fall, and we're proposing Birch Run and Oak Lane. This home area represents winter, and we're proposing Pine Grove and Spruce Ridge. And each of the home areas, each of the hallways ends in a sunroom. And we're proposing that the sunrooms be reflective of community. And so each of the sunrooms are named for a local community or hamlet in the surrounding areas around Rockwood Terrace. So Bentnick, Glenelg, Egremont, and Normanby sunrooms. And if we go to level 2, we have spring and summer. And we're proposing Orchard Way and Trillium Court, Garden View and Saugeen Trail, and the sunrooms, Welbeck, Aberdeen, McGowan Falls, and Lambton. And each of those home areas also have activity rooms and dining rooms. But in terms of the goal of keeping things simple, not too overly complicated. That's one of the goals, is to make it easy for the residents to know where they are. We worried that if we named every dining room and named every activity room, that the names would actually lose their meaning. And so the activity room in Trillium Court will be the Trillium Activity Room. The activity room in Saugeen Trail will be the Saugeen. And we think that that's what would happen naturally anyway. And so that was the decision that we've made in terms of this proposal. And that's it. So thank you. I will stop sharing and be glad to have any questions or discussion.
Thanks for the presentation, Jen. A lot of work's been done. Warden Millen, I see your hand. Go ahead, please.
Thank you, Mr. Chair, and thank you, Jennifer, for that presentation. That's pretty cool, the way that you went through all that, or Casey did, I guess, and come up with all those things. Notwithstanding the fact that you're not maybe north, south, west, east type of person, the only thing that stood out to me was the 4 townships that you've got named there. I would have thought they may have been placed geographically because they're not.
I think that that's perhaps not too late, and we'll take that feedback and share it back with. Yes, so there was not a Scott Taylor lens applied to this proposal at this point. And so I think that there's an opportunity there, and we will take your comments back and do something with that. Thank you.
Well, I was just thinking, if you started at the southeast corner with Egremont, then went to Glenelg at the northeast, and then went across to Bentick and down to Glenelg, you'd have them in the geographical sequence that they are on the map. But that's just a thing that I noticed. It's not a make or break, that's for sure. Thank you.
Through you, Mr. Chair, I suspect you wouldn't be the only person that notices that. And so appreciate your feedback.
I can remember in public school having to memorize all the different townships within Grey County. So good pickup, Mr. Warden. Other questions for Jennifer? Everyone with the outline. Always nice to have an opportunity within our meeting. Was I disconnected again?
Yep.
Am I back?
Yes.
Okay, I just welcome Kim, our CAO, and it's always nice to give you an opportunity to comment on anything that we've talked about today. Please go ahead.
Oh, good morning, everyone. Thanks for all of your thoughtful feedback and for a great set of reports this morning. One thing that I did share with everything that came out late last night from the province that might be of some interest is the province is looking to change regulations with regard to what pharmacies can do in preparation for the fall flu season. And it should, people should see increased access to various kinds of vaccines at their local pharmacies. And that we're having some discussion about the county and whether or not we'll be looking to provide further support to the team more broadly, just to make sure that we're as well prepared for a fall flu season as we can be.
Okay. Thank you, Kim. And just before I call the question on Jennifer's last report, there was a couple of comments in there, Jennifer. One being Rockwood doesn't feel like a nursing home. When you think about that, it doesn't feel like a nursing home. I guess what's a nursing home supposed to feel like? And I guess, that's a positive. I take it as a positive comment. I think all nursing homes shouldn't feel like a nursing home, and kudos to all like nursing homes. And the other one, my care. I think that speaks well for Grey County as a whole. So thanks very much. All in favor of that is carried. Thank you. And Jen, so the closed meeting, I don't think we did require a closed meeting. There wasn't any members that wished to speak in regards to any of the critical incidents. So we will move on to, is there any correspondence? I don't believe there's any correspondence. Our next meeting date is scheduled for November the 14th, 2023 at 9 a.m. And if there's nothing else from any members of the committee, I'll take a mover for adjournment. Moved by Member Patterson and seconded by Warden Millen. All in favor? Carried. Thanks very much, everyone. Hope the rest of you.
Hey, have a great day. Thank you.
You.